For a little bit of background, overprescribing is when doctors give patients more medication than they actually need. This can include things that are unnecessary, like antibiotics or opioids. There's a few reasons why this happens. Sometimes patients pressure doctors for medications even if they're not needed, and other times doctors may misdiagnose a problem or try to quickly reduce symptoms instead of treating the real cause. However, it's important to remember that not all of this is the doctor's fault. Many doctors are under serious time pressure and trying to help as many people as possible, but in some cases, financial incentives or outdated medical knowledge can also play a huge role in overprescribing. What's surprising is that about 13 to 26% of consumers contribute to this issue as well, by using leftover medication or taking prescriptions that weren't written for them. Overall, overprescribing is a problem with multiple causes, and it impacts both doctors and patients. Let's dive into the negative consequences now. Today we're going to be talking about the loss of trust, misdiagnosis, lack of knowledge, lack of follow-up, and addiction. When we talk about overprescribing, we're not just talking about too many medications. We're talking about the consequences it has on trust. When patients discover they've been given unnecessary or even harmful prescriptions, it creates doubt. They begin to question their provider's motives, and that doubt can change behavior. Because of this, people may start ignoring symptoms, skipping checkups, or avoiding treatment altogether because they're afraid of being over-medicated again. That puts their health at real risk. This can be brought to a broader level as well. Socially, this mistrust will spread. It makes entire communities more skeptical of healthcare professionals and medical advice. And when people stop following prescriptions or treatment plans, preventable diseases become harder to control. Overprescribing isn't just a medical issue, it's a trust issue. And once trust is broken, it creates a barrier between patients and the care they need. So, what does an in-depth solution look like? Our group came up with an idea that gives patients a meaningful voice in their own treatment. A system where every prescription comes with clear, accessible documentation. Why it's being prescribed, what the expected benefits are, the potential side effects, and even non-medication alternatives. Digital tools could make this easy, showing patients their progress in real time and helping them see what's working and what isn't. Before a prescription is finalized, patients could meet virtually with their provider through a platform. This gives people space to ask questions, express concerns, and fully understand their options. It's a communication-first model that builds trust by showing that decisions are tailored to the patient's actual needs. The same platform would also let patients report side effects, missed doses, or anything they're even worried about. Providers could then adjust the treatment plan right away. That responsiveness not only improves health outcomes, but it also reduces the perception of unnecessary or careless prescribing. This is the heart of data-driven decision-making in healthcare. Over time, patients would be able to see a transparent record of how their provider listens, responds, and adapts. That kind of consistency builds long-term trust, not just compliance for one prescription, but a stronger, more reliable relationship between patients and the healthcare system as a whole.
There are many different consequences or effects from overprescribing. One of the most significant ones is misdiagnosis. Now, this is seen through a couple different ways. So one of the biggest consequences of misdiagnosis is delayed proper treatment. We see that the incorrect diagnosis can mean that real conditions remain untreated. Now, it may solve a symptom or two in the short term, but over time can lead to a worsening of all symptoms as well as certain conditions when they go untreated. Now, this also can lead us to unnecessary medications. So when patients start to rely on medication that they don't fully need or their body doesn't need to process, they can increase not only the risk of side effects to the medication, but also they end up dealing with the dependency on them, which can lead to further consequences that are mentioned in this presentation, like addiction. Now, the mental strain that is seen from the different misdiagnoses and what it can do to a person also puts a strain on people. One of this is dealing with they end up dealing with more emotions like fear, anxiety, and confusion. They also may not fully understand what's important to their own health and understanding why they need to take certain medication in place of others. Another part of this is prolonged recovery. This This means that additional medications that aren't necessary actually can lead to further delays in the recovery. Then we have physical issues. So from some of these other problems and consequences with misdiagnosis, physical issues can lead to furthering of conditions, as well as not understanding why the condition is getting worse. It can even allow for more injuries. Now that we've looked at some of the individual consequences of misdiagnosis, let's look at the social consequences of it. One of the big ones that we see is an increased healthcare cost. This is because of the needed additional treatment and repeat visits that doctors would experience based on this. With these repeat visits, it would cause a struggle in the demand and require a higher amount of doctors. Now, this also leads us into medication misuse. When people are misdiagnosed, they may be required to lean on medication that they don't need, which can further the risk of not only addiction, but it also increases a risk of medication resistance, which some people may go through even if the medication is needed later. Another part of this is lower productivity. When the misdiagnosed person continues to struggle with the same issues, it not only hurts their mental and physical states, but it can also affect everything that they're doing. This means that people may struggle with being productive or even wanting to go through the things of daily life. Another part of this is an increased strain on the healthcare system. We already see a high amount of strain within our healthcare system, and with the added addition of more overprescribing or more misdiagnoses, we would see more complications and a higher number of appointments that patients would have to go through. This would also lead us into an increase in public health risk. With this higher strain on our public healthcare system, we would see things like viruses spread a lot more, or maybe not as many people getting the help that they need, leading to other issues, whether that be chronically or just an issue that they've never dealt with before. Now that we've talked about some negative consequences, let's talk about some solutions to misdiagnosis. One of the biggest ways we can do this is through diagnostic accuracy. When we see patients, evaluating them more thoroughly and focusing on diagnostic testing paired with analyzing the symptoms is a good way to start. One way we can do this is through having patients accurately and thoroughly document their symptoms and the things they're dealing with on a daily basis, and take record of it and compare it to what we know. Another part of finding solutions to misdiagnosis is being willing to get a second opinion or finding additional opinions. Encouraging communication between not only doctor's office, but also being willing to see specialists and introducing different healthcare specialists to a patient could help with solving some of these issues much sooner. This would also allow for patients to not only have more trust in their healthcare provider, but also to help identify and understand their issues that they deal with better. Another part of this is a more patient-focused mindset. This would mean implementing appointments that not only reassess the diagnosis, but making sure that the patient feels like the treatment is effective and is helping them manage and live with their symptoms. Another part of this would be early monitoring of an issue. When something comes to our attention, focusing more on monitoring it and knowing what symptoms are going through the patient is going through. This will also allow providers to make needed adjustments or to even take a patient off of a medication in case it is not doing what it is intended to do. Another aspect of this would be a non-medical treatment or even just more patient education, focusing less on the prescribing portion of it and finding a way to eliminate the source of the problem, not just through medication, but trying to find other solutions if a patient isn't exactly comfortable with the medication being provided. The next goal would be to educate patients on their issues and making sure that they understand how the treatment works and whether or not they have other options. This could also look like providing patients with a better set of resources, which can be done through more second opinions and just having a more patient-focused appointment.
A lot of times consumers don't know as much as the provider knows when it comes to medication, because the provider was trained on how it affects genetics and affects each person individually. People tend to use meds such as antibiotics, painkillers, and anxiety meds to be quick solutions, and they don't know what the long-term risks are and how it's going to harm them in the future. This lack of knowledge creates a situation where consumers are listening to their friends or Google or TikTok about what kind of medication they should take, and they're trying to pressure their provider into giving it to them, and that just kind of creates overprescribing. Individual consequences of this are misusing the medication because they don't understand the dosage, and that sometimes they think, hey, it's not working because they weren't told the purpose of the medication and how it should work for them. They take another dose and they start overdosing, which creates dependency and addiction, especially with opioids and benzos. And once you have addiction and all that, the antibiotics are just kind of in your body all the time, and your body creates a resistance to it, so that when you actually need it, it won't work for you. And that in turn, because people are using it when they don't need it, it creates higher costs, because in the economy, when demand goes up, that doesn't mean supply automatically goes up too. But the cost of it sure does, which is not very fun. And then they have side effects that they don't even realize that they're going to have from overusing this. Social consequences are like overprescribing. It becomes normalized because, well, blah blah blah's doctor did for them, why can't you do it for me? Stuff like that, and it makes it very difficult for doctors to keep saying no, because it's the same thing again and again and again. And then, once again, like we talked about, your body becoming resistant to the antibiotics, people get sick, and then they start spreading that sickness. And then when everyone's sick at once, they all go to the doctor, and the doctor is overwhelmed. This makes the addiction rates go up, which influences the families, because now they have family members who are addicted, who need to get help, that sometimes they don't even know they need to get help. And it's just like a whole mental thing sometimes. And then also some people stop going to work and stuff like that. It becomes a big issue socially. The solution to this is educating people on medicine, doing infographics and videos and campaigns and marketing it well, just so people can understand, hey, at the very least, before you put a medication in your body, talk to your doctor so you know how it affects you. And by doing this, people are going to be a little bit more responsible with what they're doing, understand the issues with it, and they will be less likely to pressure the doctors. You could also do a app where it's essentially giving the doctors, hey, I took this amount of dosage today, this is how I'm feeling, these are my moods, these are my symptoms, I don't like this, I do like this, because you don't see your doctor all the time. So it essentially makes it where they get a more real-time version of how you are feeling, so they know how to adjust it. Maybe you're taking too high of a dosage, too low of a dosage, maybe it's just not the right med for you. It just makes people a lot more informed, and doctors a lot less pressured, and the communication is what really needs to be fixed here.
Overprescribing due to a lack of follow up is another thing that can come up with overprescribing. So that's basically just that doctors and patients get disconnected after the first visit or after a few visits, and then they're on those medications for a long time and it's unchecked, and so they can't talk to the doctors about how they're feeling or symptoms that change or side effects that come up, and so they can be on too much medication for too long, and so that's where the overprescribing comes in, because the doctor just never checked back in and never saw the situation, and they continued to take a medicine they didn't necessarily need, or that could even damage them more. So the individual consequences of that is that a lot of people can end up paying too much because healthcare is a very personalized thing. And so, with different body types and different conditions, there's a lot of different reasons you can need more or less of medications. And, like, even if your family is more prone to being addicted, that can change the type of medication you're on. So, individually, you can get addicted to things, you can spend too much money on them, you can end up with medications you don't need. So it's bad because then patients aren't necessarily feeling how they're supposed to feel, because obviously after, like, you get a major back surgery or something like that where these opioids and things come into play during these major surgeries and major illnesses, all these strong painkillers and anxiety medications and depression medications for these severe cases can change your hormones and they can change the way you think. And so it can ruin people's lives if they're on these medications, and they can be almost zombie like and different from who they were because the medications just mute everything. And so it seems like it's solving it, but then they never check back in with a doctor. And so that's where the no follow-ups is the problem, because even a follow-up 3 months or a year later could make a big difference. Whereas if someone goes the next 4 years using something, then they're reliant on that and it is not what it was supposed to be doing. So they need to have those check-ins so they don't become like dealing with all of those issues. So this damages society because more and more people are on a bunch of medications. Like, you can talk to people and 5 out of 10 are on, whether it's antibiotics for strep throat, which isn't a big deal obviously, or bigger things like opioids and codeine and uh, some type of methyl Tylenol. I don't know all the names of all the prescriptions, but there's severe painkillers and even just things like Adderall. Like, college kids think Adderall is a joke and just try and take it, and that's not even a prescribed thing. But so if that's an issue, imagine how much more severe it is when all these kids know they can just go to a doctor, complain about one thing, and just get drugged up for it. Like, that's not good for society, obviously, to have people just knowing that the doctor's office of all places is going to be their easiest way to get drugs. And so if they tell the doctor one thing and then never have those follow-ups after, they can just continue to get those drugs and continue to have those problems. And then since they don't have the follow-ups and the doctor's not actually monitoring the condition and they never check in again because they got what they wanted, then more and more people are on more and more lists of medications. And if you want to be more normal, you shouldn't take more and more drugs to cancel all the other drugs. You should try and take less and less. But doctors don't necessarily have the time or energy to deal with people when they're doing all that type of thing. The solution for this is, there's obviously lots of different ways where people could check in more. And the hard part about this is that so many doctors are so busy and then healthcare is so expensive that those follow-up checks that are so crucial for patients. I work at an eye doctor's clinic right now, and that's actually one of the things we see pretty often is someone will come in with metal in their eye, and then they'll start taking the right type of eye drop and get the metal removed, and they get a lot better. But then they don't have follow-ups with the doctor, and then the follow-ups cost money too because it's still an appointment. And so then they don't come in for the follow-up, and then 3 days later they call and they're having super red eyes and it's got worse. And it's because that eye drop was only meant for a certain amount of time to make a certain part better, and after that certain time they were supposed to come in for that follow-up, and then they didn't. And so then the eye drop made things worse because it got rid of the swelling, but the swelling comes from the blood vessels. So if the blood vessels are more tensed up and constricted from those eye drops, this is just one example obviously, then it actually will make the condition worse. And so with medications, it's the same thing. Like, if you have a problem with your back nerve pain and then you get on drugs for it, then you're just on them forever. Then you'll just start to lose feeling in places you should have feeling because you're always on painkillers and you don't even notice. And that's kind of happens with older people a lot more, that just don't really know because they can't feel lots of things anyways. Like, my grandpa stepped on a piece of glass and got it infected in his foot because he was on all these painkillers for his back, so he couldn't feel the glass in his foot. And so obviously there's a fine line between prescribing the right amount and over prescribing, and so that's why these follow-ups are so crucial. So sorry, I just talked a lot, but the solution is that with a mobile app that connects patients, or for older patients, scheduling those checkups and explaining how important they are, so they come in physically and can talk about those symptoms, whether it be on the app or in person, and they can talk about how the medication's going, and they can talk about side effects they may or may not be having, and then scheduling them out 1 week, 1 month, 3 months, 6 months, however long it's going to be, because obviously it's case by case, and that's part of the problem. Keeping in touch with the doctor as they continue to take those medications will help them, and so they won't just have an unlimited pile of painkillers that they can take whenever they want because the doctor didn't know their situation and never checked back in and just knew it at its severest case, and as it got better, the medication didn't wean off because the doctor didn't know about it. So when they're more in touch with the doctor on apps, they'll be more accountable, and the doctors will see if it's an overuse or not, and then the patients won't be overprescribed as often, and when they are, it'll go away more because there will be less and less drugs because the doctors will have more and more knowledge. And also, as they check in more with the doctors, they can do more studies and record how certain body types with certain cases respond to certain drugs, and be able to more accurately just put a blanket over a body type and say, you have this, you're built like this, your hormones and genetics are this, so this is how much you're going to need, a lot more accurately after they have those check-ins with patients over the years and know how it's going to react, versus just prescribing them a certain amount and letting them go and never talking to them again while they have a bottle full of pills. So I know I just talked a lot. I don't remember if there was a time limit. I probably should check. But yeah, that is why follow-ups are important with overprescribing.
All right, next we're going to take a look at addiction. Addiction is one of the most serious consequences of overprescription in the medical industry. So when patients are given medications, especially opioids or anxiety medications that are stronger or last longer than are actually required, the risk of dependence increases very quickly. What starts out as a legitimate treatment can turn into reliance on the medication just to feel normal. Individually, this can lead to withdrawal symptoms, decreased quality of life, and difficulty functioning in everyday situations. Okay, so on the individual level, addiction caused by overprescribing has some of the most damaging effects. When people are given medications like opioids for longer or at higher doses than truly needed, their bodies can quickly develop a dependence. This can look like needing medication just to feel normal, experiencing withdrawal symptoms, or turning the medication for emotional coping rather than medical use. Another individual consequence is how addiction changes decision-making. Instead of seeking real treatment for the underlying problem, individuals may start seeking reliance on the drug itself. Socially, addiction tied to overprescribing creates ripple effects across the entire communities. One major consequence is the strain on local healthcare systems, from increased ER visits to higher demand for addiction treatment services. Overprescribing also contributes to broader crises like the opioid epidemic, which has brought increased accidental overdoses, family instability, and lost productivity. On top of that, widespread addiction undermines trust in healthcare providers when communities see that prescriptions are being given out too easily. It damages confidence in medical professionals and the healthcare system as a whole. To address this, our solution focuses on two key tools. First, a real-time prescription monitoring system this alerts providers if patients are refilling their prescriptions too quickly, increasing doses too often, or receiving overlapping prescriptions. It helps catch early warning signs of dependence before things escalate. And the second is a patient tracking app. This lets patients log their symptoms, track their daily medication use, receive reminders for safe dosing, and even check in with their provider when something doesn't feel right. Together, these tools reduce misuse, lessen pressure on doctors to prescribe more, and promote more responsible medication behavior at both the individual and the community level.